So ladies and gentlemen, you all viewing us from all across the globe, we are happy to have you doing this workshop. Feel free to share the link to all your connects. Let's have many people on board. Actually, this is a Zoom call and a Zoom conference, and those who can access the link on Zoom, it will be ideal. Those who can't, you can just follow us here on Facebook. Feel free to drop your questions. We'll be taking questions in the course of the presentation, and we hope that this is going to be interesting for us all. All right, for those joining us, we are live on Facebook. You can share the link. You can share the link and so that everybody can join. All right, we welcome all those joining. We welcome all those joining. We encourage us to share the both the Zoom and the Facebook links far and wide so that we can kickstart this presentation. We'll be starting in 5 minutes. All right, ladies and gentlemen, it's 15 minutes past 18 hours, GMT plus one. That is 18 hours this workshop, and we actually planned that this starts at exactly 6 p.m. So if you're All right, ladies and gentlemen, we welcome you to this presentation. This is actually the second day of our presentation where we want to talk about the psychological impact of COVID-19 on our mental health. So today is going to be an interactive session. It's a team of three, and we want to reach out to the world to be able to help us um, educate the world's population. So today we are starting the second session of the presentation, and we hope that it's going to be inspiring to everybody. We hope that it's going to be inspiring to everybody. The goal of this is for us to emerge powerful and also to emerge ambassadors of promoting mental health in our various communities. So you are all officially welcome to this presentation. For the start of this presentation, I am Sintieh, who will be guiding all through the presentation alongside with the team. So thank you all for tuning in. Thank you all for taking out time to share with us your experience with respect to COVID-19. So for today's presentation, we are going to adopt this outline. We are going to look at the overview, the burden, and the epidemiology of COVID-19, which is going to be handled by myself. We are going to look at the burden of COVID-19 as well as its mental health effects, and that is going to be handled by Dr. Bonhida Take. And we are going to also look at the coping strategies with respect to the mental health effects and consequences. It's going to be handled by our mental health expert, Ms. Fosso Epiphany. So before we begin this presentation, I would like us to review some ground rules, okay, for effective presentation. Now, this is an online presentation, unlike the on-site presentation that we would have had if we weren't in this pandemic. So first things first, if you joined the presentation, you realize that your mic was mute automatically. So we encourage everybody to mute the mic so that your background noise doesn't interfere with the presenter's presentation. In the course of the presentation, if you notice that you have a question with respect to the slide that is being shared, there's a chat section in the Zoom control. You can drop your question in the chat. We're going to review the questions during the Q&A session. As well, during the Q&A session, if you have a question, there is still an option in the Zoom control tab that says raise hand. You can just click on it and we'll see the person that is raising hand and you'll be called up for your question. Feel free to close your camera, to mute your mic if you're doing something that you think is going to distract the audience. Of note, this presentation is going live on Facebook, so the whole world is seeing us. So you don't want to let your video display to the world when you're not doing something that is not palatable for the whole world to see. We plead with you not to interrupt the presentation in any way. So that said, I believe you're set for the presentation. If you're present and you're listening to me, just by unmuting your mic and saying hello would suffice to let me know that I can proceed.
Hello.
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 All right, that is great. I've gotten several hellos. So, okay, let's mute our mics and let's ride on. So for this first part of the presentation, we're going to be talking about the overview, the epidemiology, and the burden of COVID-19. For this presentation, I am Sintieh. I'm a medical doctor with the Cameroon Baptist Convention, presently working in Yaoundé, Cameroon's capital, and that is where we're hosting this call from. So let's proceed. What is COVID-19? In December of 2019, a cluster of pneumonia cases were identified in China. And these pneumonia cases were unknown to the science persons who had this pneumonia were from or had visited the Wuhan seafood market. And so we then said, what is unique about this? Why are these persons coming out from the Wuhan seafood market? Definitely it's from an animal source. And so in early January, this disease was tagged the novel coronavirus. It was termed coronavirus because coronavirus is a group of virus where they have their genetic material, the DNA, but in this case, it's, and crown in Latin stands for corona. So that is why they called it the novel coronavirus. But later on in January, with the WHO coming in and the International System of Classification of Disease, it was then termed COVID-19, which simply means the coronavirus disease that was discovered in 2019. So right up to date, the exact etiology or the exact origin of the disease is not known, but it is hypothesized by scientists that these might originate from bats. So this hypothesis is made based from other previous pandemics that have plagued the world by other coronaviruses. These include the Middle East Respiratory Syndrome coronavirus that occurred in 2012 in the dromedary camels. We also have the Severe Acute Respiratory Syndrome coronavirus type 1, which occurred in 2002, still in China. So after genetic sequences of the current coronavirus type 2, it was seen that the coronaviruses that caused the MERS and the SARS were 90% similar to that which is causing it, and all of them originated from bats. So current hypothesis is that the primary source of this virus might have come from the bat population. However, we also have more progress to say that they are intermediate hosts. So from the origin, how did it get to them? So we notice that presently they say pangolins and snakes are the intermediate host of the coronavirus. So this has been a good progress, saying that a lot of the genetic sequence of the virus that has been identified so far, it's 75 to 90% similar to that which is found in snakes and in the pangolins. And we ask ourselves, why then are these things located in animals and then it comes into human population? It occurs during a phenomenon termed the spillover. A spillover is either a genetic upgrade by the virus that changes that, okay, I want to infect human and it moves to a human population, or it is as a result of human activity, which leads to this transmission of this virus from an animal population to a human population. Like we noticed that initially, the first cases were identified to have visited the Wuhan seafood market. This is a very prominent market where we have all forms of animals that are being sold. And so this is possibly the area where we had this spillover, because human activity had to touch this natural habitat. And of note at this point, we want to let you know that we'll continue having these pandemics so long as human exploration progresses, so long as we keep getting into the ecosystem and to parts of nature that have not been explored. We will be getting into the human population, into the animal population, and definitely picking up thousands or millions of bacteria that are occurring in these animal population. So what is the current epidemiology of the disease? We begin with its methods of spread. Currently, we know that it is spread by means of air droplets, okay? So somebody who is infected with the virus will cough or sneeze, and these viral particles are transmitted in droplets through the air, okay? Now, this can go through a short range distance when the person is very close by to you, or a long range distance where we refer to it as an aerosol means of transmission. So when these happen, you have a long range transmission. So next we have the next means of transmission we have is the means of what we call fomites. So contaminated surfaces. Somebody sneezes or coughs on a surface, and if you come and pick it up, you'll definitely get contaminated. So if you touch this surface with your hand and then you get it to your nostrils, your face, your eyes, definitely you are likely to infect them. Of note, right up to date, current studies indicate that these viral particles, these air droplets containing these particles, can last up to 6 hours in air. That is why the campaign has been wear face masks, practice social distancing as much as possible. We also hypothesize that the trajectory drops when the distance exceeds a 1 to 2 meter distance. So those are reasons why we encourage that people should practice social distancing. Of note, some scientists have hypothesized that this can also be transmitted through the sexual route. And this is being elaborated on this point to say that with this quarantine, with this lockdowns and curfew that have been instituted, we know that sexual activity will be increased, but we say that practicing safe sex too is a means of preventing the spread. Next, we look at the lifespan of the virus. This slide was actually included following a question that was asked yesterday's presentation with respect to the lifestyle of this virus. If you see that on clothing, on textile material, it can last up to 2 days. On glass, it can last up to 5 days. On jewelries, it can last up to 8 hours. On plastics, things that we use to pass through doors, it can last up to 7 days. On our doorknobs, the viral particles can last up to 3 days. On banknotes, it can last up to 4 days. And in dishes, chefing dishes, and so on and so forth, it can last up to 3 days. This was actually a post that was shared by the Impact Medics and the Sintieh Research Academy on Facebook some time ago while we're educating the population. You can check on this and have more details on that. But this is actually the approximated lifetime from current studies that show how the virus can last in various particles. Notably in air, it can last up to 8 hours. So definitely the campaign is to wear the face masks and practice social distancing as much as possible. Next, we look at which groups are most at risk with respect to this disease. So we first of all highlight the fact that animal workers, persons that take care of the animal farms, are at high risk because they are the persons that will cause the spillover because they interact with animals on a daily basis. The next risk group are health personnel. Because we deal with sick persons, we are also exposed. That is why practicing the protective measures is very important for both professions. The next risk group are carers of the sick. If you have someone who is sick, do not practice what is elaborated on this picture. Wear your face masks, take care of the sick with so many precautionary measures so that you don't get yourself infected because you're actually a high risk group. Next, we are going to look at exactly the symptoms. Now, as we said earlier, the coronavirus type 2, the COVID-19 virus, it's a new virus. It's the only coronavirus as of date that is able to cause severe symptoms. Of note, coronaviruses have existed from time immemorial and they've been causing mild disease. And we know this because all of us have had a cold, we've had catarrh and cough, and it lasts for 10 to 14 days and you get healed without any drug if you need them. But this has been the coronavirus that has taken persons from 14 days into an intensive care unit requiring oxygen and even dying. That is why there's so much propagation of this disease. And so persons with this disease will present with fever, cough, shortness of breath, body aches, a sore throat, a running nose, and in severe cases, they have loss of smell as well. They also present with diarrhea. So as a medical personnel, we've had patients or persons who come in with diarrhea and we manipulate with these patients. And in the end, this person tests positive for COVID-19. So that's why we see health workers are at the front line and they are most exposed to this disease. There's a constellation of symptoms and we just need to keep a high suspicion index to be able to get the most cases early on. Now, what is the current burden of the disease? As of yesterday, the World Health Organization reported that we have over 8.5 million cases with over 100,000 cases recorded in just 24 hours. Currently, the death toll ranges over 450,000 deaths, with 6,000 occurring in 24 hours. Now, we highlight Africa here because our continent has the least number of cases, but what is of importance to note is that our epidemic is on its rise. The number of cases keep increasing. While in other continents, we've had a plateauing of these cases. In Europe, in the US, the cases are actually, the number of new cases compared to the beginning are actually reducing. That is why we want to empower Africans to first of all believe that these diseases do exist. This brings us to the fact that we look at the picture of Africa with South Africa having over 87,000 cases already, Nigeria 19,000, Ghana 13,000, Algeria 11,000, and Cameroon over 10,000 cases. And so we say, why are this number of cases still rising in Africa despite the mediatization of the virus? And we say the first thing is, in our setting in Cameroon in particular, many persons do not even believe that the virus does exist. As a health personnel, I will tell you, yes, we've seen the cases, we've been there, we've been exposed. And so if you need a second clear proof that it does exist, yeah, the virus does exist, the pandemic is real. So let's practice the preventive measures. Moving on next, we can't close this part of the presentation without looking at the myths surrounding the coronavirus. The first thing is, yeah, shoes could transmit the virus, but definitely at this point in time, we do not have enough evidence to say that. But it's good to be safe. You have to be safe than sorry. So if you put on your shoes, you go out to work, you go to the market, when you come back, keep those shoes outside, don't get them into the house, put on your gloves, wash these shoes and keep them dry. Basically, you prevent any bacteria or any other infection that you could take into your house by wearing your shoes into your house from the market. As well, some person says that wearing prolonged face masks for a period of time will reduce the oxygen that gets into your system. Well, this is wrong because the face masks are thin clothing, and actually they allow air to circulate in the nostrils, and it does not affect the amount of oxygen that you need in the body. Better of note, you cannot wear face masks to carry out aerobic sports. You can't go for jogging with a face mask. Definitely, you're going to intoxicate yourself. You're going to suffocate yourself because the energy demand increases. And secondly, the face mask gets wet with your sweat. And if viral particles have been dropped on the face mask, you are increasing the risks of transmission. So putting on face masks is good, but you have to know how to put them on diligently. Some persons also highlight that drinking alcohol kills the virus. Well, this is wrong. This is false because alcohol in itself is a toxin and it weighs down on your immune system. In the long run, it instead predisposes you to more severe forms of the pandemic. Now we look at the famous 5G. It's been spoken in all forms of media that the network is the cause of the coronavirus, or it's what transmits the coronavirus. Well, if we might go back to basic science, I will encourage all of us to look at the rainbow. The rainbow is visible light. It falls in the visible light wavelength of lights that we see, and the 5G is radio wave. Radio wave has a weaker wavelength compared to visible light that permits you and I to see. Therefore, even the light that permits you and I to see is more hazardous compared to radio waves. And so thinking that radio wave is what is causing the death or is what is transmitting the virus is a really, really false myth that we need to go up from. Secondly, we are in Africa and we have a large pharmacopoeia of drugs that have been hypothesized. Famously, we have ginger, garlic, and a mixture with honey that says that it cures the virus. As a health professional or as somebody who thinks logically, I'll tell you, this isn't true. There isn't any cure yet for coronavirus, but what you have to note is that ginger and garlic and honey and so on, they are products, they are supplements that have some relieving effects in the airway. They will dry off your airway and cause you to feel better. It's same thing you do when you have a cough. You will take a cough syrup and so on and so forth, and you'll feel better. Before coronavirus came, we had been taking the ginger and garlic, but now what you have with GI symptoms, with digestive symptoms and complications with their bowels because they've taken large quantities of these and it's actually intoxicating and harming their livers. The next is the problem that there is a drug that cures coronavirus. As of date, there is no drug that cures coronavirus. Last week, we had a release that a drug could improve symptoms, could improve survival for patients that are hospitalized. This was seen with dexamethasone. It's one of the drugs that were used for trial, but it's not a cure. It's just to tell us that this drug is capable of improving outcomes for persons who are on ICU. So presently, we've had campaigns on hydrochloroquine that persons have abused and intoxified themselves with that. And we've had cases of that. The United States have withdrawn that from their trial drugs. The UK has done the same thing. So hydrochloroquine is not the cure. Chloroquine is not a cure for coronavirus. And so please, let's stay safe by not intoxicating ourselves with these drugs. At this point, we've come to the end of the first part of this presentation, and I hope that we actually learned something with respect to what coronavirus actually is. Up next, we'll be looking at the second part of the Dr. Brunhilde Take, who's going to be all on the program, and we hope that you are actually learning something about the virus. We hope that you are actually learning something about the virus. So, Dr. Brunhilde, are you there?
Hello, everyone. Thank you, Dr. Sintieh, for your brilliant presentation. Thank you for those of you who have joined us today on today's session of our workshop entitled COVID-19 and our mental health. I am Dr. Brunhilde Take, currently working at Mbopi Baptist Hospital, Douala, and I'll be taking us through the presentation the effects and consequences of COVID-19 on our mental health. Before I begin, I want to ensure people are hearing me and they are seeing my screen. Please, can I hear something from the background? Is
Definitely, I'm
anybody,
seeing your
can people
screen.
see my screen?
Yes, we're seeing your screen.
All right, thank you very
100%.
much. Thank you. All right, so we move on. Our presentation will adopt this outline. Beginning from an introduction, we'll define a few terms. We'll talk about the effects of COVID-19 on the mental health of adults and children as well, and the consequences of COVID-19 on our mental health. We have been talking about mental health. What is mental health actually? WHO defines mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. There are three components of mental health: emotional well-being, which includes being happy, being interested in life, and being satisfied. Psychological well-being includes liking most parts of one's personality, being good at managing the responsibilities of daily life, having a good relationship with others, and being satisfied with one's own life. For social well-being, it refers to positive functioning and involves having to contribute to society, social integration, social actualization, and social coherence. There are a variety of mental health disorders and their presentations intersect. By intersect, we mean some of these conditions may present with similar symptoms. You would agree with me that once a person is labeled mentally ill, the first thing that comes to our mind is either the person is moving on the streets naked, or the person is being aggressive, or the person is talking to him or herself or behaving in an abnormal way. However, these disorders are generally characterized by abnormal thoughts, perceptions, emotions, behaviors, and relationships with others. They include, but are not limited to, anxiety, depression, substance abuse, obsessive compulsive disorder, personality disorder, schizophrenia, psychosis, or suicidal feelings. The current crisis has greatly affected the world. The effects of this crisis is not only limited to our physical health or to the economy of our nations, but more and more people are affected mentally, ranging from policymakers right down to children. Only that the effects may be milder in some people and others may not even realize that they have a problem. There is a lot of fear, worry, and uncertainty. Mental health experts believe that our mental health will not be the same again because the impacts of this pandemic may linger even after the pandemic. Some persons have higher degrees of mental distress, such as healthcare workers. These people are facing hardships during this pandemic. They are working under extraordinary circumstances. They are likely to feel under pressure or stressed. In many cases, they are worried about transmitting this infection or this disease to their loved ones. Older adults, especially those in isolation or those with cognitive impairment, they may become more and more anxious, angry, or stressed and withdrawn. Children as well, like I had mentioned before, may feel sad and are often more afraid. In people with pre-existing mental disorders, symptoms may likely worsen with the crisis. For the purpose of this presentation, we'll define effect as a change that an event causes in somebody or something, and consequence as a negative result. Moving on to the effects of COVID-19 on our mental health. The first effect we are going to talk about is isolation. Because of the pandemic, people are isolated. Isolation happens to be one of the measures to prevent the spread of COVID-19. People are isolated either when they are tested positive or as a result of the lockdown measures. Imagine those in isolation centers or who are in quarantine centers. They don't have their loved ones to take care of them. These people, they are lonely. Loneliness increases the risk of depression, it lowers their self-esteem, and it increases the risk of suicide and anxiety. Moving on to the next effect, which is anxiety. Why are people anxious? People fear being infected. People fear dying from COVID-19. People fear being stigmatized or judged by the society. Some people are even afraid if they don't know whether the society would accept them back normally after they recover from the COVID-19 infection. A survey was conducted among people in the Asia Pacific region, and at least 30% of the respondents in this survey agreed to anxiety. The level of anxiety, however, depends on the area where we find ourselves. I'll take, for example, here in Cameroon, the most affected cities are Douala and Yaoundé. So the people in Douala or in Yaoundé will be more anxious compared to someone who is, take, for example, Kumba, where people don't even probably believe that the disease actually exists. Moving on to the next effect, people are developing depressive symptoms like sadness, feeling of hopelessness, helplessness, loss of interest in their environment. Because of the uncertainty, some people begin to feel like they are living in a black hole. These depressive symptoms are as a result of the circumstances surrounding us. You wake up in the morning to the news, increasing number of people getting infected, increasing number of deaths. The next effect we'll be talking about is sleep disorders. A lot of people are finding it difficult to sleep because they are either afraid of getting infected or they are afraid of dying from COVID-19 infection. Imagine now if you die of COVID-19, your family does not even have time to pay you a last respect. They just go and bury you immediately. Parents, for example, cannot sleep well because they are not only worried about themselves, they are worried about their children as well. Anxiety and depression lead to sleep changes, and healthcare workers, for example, may also experience a lot of sleep disorders. People are feeling ostracized from their friends, from their family, from their neighbors. Others, probably because no one is checking on them. Healthcare workers are also feeling excluded because their family or neighbors may tend to feel like they are the ones that are going to bring the infection to them. And now, when you can't sleep, when you feel sad, when you feel excluded and hopeless, the body finds a way to adapt. For some, they become addicted to their phones. They are overly concerned about social media, and they have an uncontrollable urge to always log on to the various platforms, impairing other aspects of their lives. There is a quote by Baran 9 which says social media is like suicide in daily installments. In the same light as people find solace in social media, others turn to drugs and alcohol. Substance abuse is usually a coping mechanism to cope with sleep changes, to cope with depression, and to cope with anxiety. We have also heard from Dr. Sintieh's presentation that people believe that alcohol kills the virus in their system. So you can imagine other people killing themselves with alcohol because they feel that once they drink that quantity of alcohol, they will not be infected with coronavirus. We have also woken up to the news of people having an overdose of chloroquine because there was a news that says that okay, chloroquine cures coronavirus or can prevent coronavirus, and people are now taking an overdose of chloroquine because of the fear. And now, because of the lockdown measures, many people are exposed to domestic violence. Having lost our loved ones or family members due to COVID-19 infection, we are not able to see their remains before burial. Not being able to mourn our loved ones in a culturally acceptable way has an effect on our mental health. The last effect we are going to be talking about is disruption of leisure activities. People have been unable to go or do the leisure activities they had planned for because of the current pandemic. We now wake up to birthdays being celebrated on Zoom. People are having online dinners. Outdoor or leisure activities have reduced significantly. As earlier mentioned, everyone is affected mentally by this pandemic. Even children as well are affected. And just as adults are anxious, children as well anxious. Children are sad, they worry a lot, especially because they cannot fully understand what is truly happening. They begin having sleep problems, they cry excessively. In the past 3 months, children have not gone to school, not going to school, staying at home. It decreases their intellectual development, and there's also an increased potential for child abuse. Having spoken about the effects of COVID-19 on our mental health, we'll move on to the consequences of COVID-19 on our mental health. These consequences are, but not limited to, residual stress, obsessive compulsive disorder, psychosomatic disorder, post-traumatic stress disorder, suicide, increased pressures, either financial or educational, difficulty re-engaging with the changes that are forthcoming, relapse in patients with pre-existing mental conditions, sleep disorder, depression and anxiety. We will throw more light on the first 5 consequences mentioned on this list. 6 months into the pandemic, there is a lot of fear and uncertainty. People are adapting to new ways of work and new ways of study. Before, to work, you have to leave your house in the morning. Let's say you start work at 8, you either share a table with your colleague or you share an office with a colleague. But now, you cannot meet your colleague physically, you interact with them virtually. Likewise, school, instead of going to class, we are now turning to online studying. This causes a lot of stress on some people, and it may be overwhelming, consequently leading to other health conditions. Even more worrisome is the fact that experts say the pandemic will come in phases. This is just phase 1 of the pandemic, and we are at this level. What happens when the other phases will come? Moving on to the next consequence of COVID-19 on our mental health, which is obsessive compulsive disorder. With the constant use of the virus staying active on inanimate surfaces, many people are developing obsessions and abnormal behaviors with respect to the safety measures put in place. This disorder may be new for some people, or it may be heightened in those with already pre-existing obsessive compulsive disorder. And people with obsessive compulsive disorder are usually afraid of contamination, and as such, you find them frequently washing their hands or bathing, frequently using hand sanitizers. It just suffices for somebody to talk to you and you remove your hand sanitizer and you put on your hand. They struggle with perfectionism. No one actually can perfectly protect themselves from COVID-19. They also struggle with thoughts of harming others. In this case, they fear that they may infect others. We move on to the next consequence, which is psychosomatic disorder. The human mind is like a software, and the body is the hardware. The mind gives commands to the body. So whatever the mind thinks, the body manifests. That's why you find people who just all of a sudden develop cough, sore throat, difficulty in breathing just by hearing that one of the people they have come in contact with is a suspected case of COVID-19. And then we have post-traumatic stress disorder as another consequence of COVID-19 on our mental health. This occurs in people after a traumatic event, in this case, the COVID-19 crisis. The psychological trauma causes these people to have constant flashbacks, nightmares, negative thoughts and feelings about themselves, and outbursts of anger. They even go to the extent of avoiding people and activities. So the last consequence we'll be talking about for this part of the presentation, which is suicide. A study in New Delhi in India reported 300 deaths due to suicide as a result of the lockdown. This number, according to the article, is an underestimate, meaning more people are killing themselves or have killed themselves as a result of this pandemic, either for fear of getting infected or for fear of dying from COVID-19. We had mentioned before that one of the effects of COVID-19 on our mental health is that we are not able to mourn our loved ones in an appropriate way. So some people may just say, for me to die and just be buried in the next 1 or 2 hours, and for my family, they're not even able to pay their last respect, I better just die before this COVID-19 even kills me. The next reason may be from loneliness. I mentioned that isolation increases the risk of suicide. Other reasons from alcohol or drug withdrawal. And at this point, ladies and gentlemen, we have come to the end of this part of the presentation. Thank you very much for listening.
Thank you very much, Dr. Brunhilda, for this brilliant presentation. For those just joining us, we are on the second day of a workshop entitled COVID-19 and Mental Health, a Psychological Crisis. And the reason for this presentation or for this workshop is to actually empower Africans to emerge out of this pandemic psychologically strong. We are moving to the third part of our presentation, which is going to be handled by our mental health expert, Ms. Fosso Epiphany. She's going to be telling us about the strategies of coping with the stress brought about by COVID-19. So actually, if you're joining now, you've missed, but you haven't missed much. So we trust that you're going to grab some strategies you're going to be using in the course of this pandemic so that you emerge stronger. So Miss Epiphany, are you there? Can you get me? Hello, Miss Epiphany, can you get me? We can see your slide. All right, Miss Epiphany, can you get me?
Hello? Are we
Yes, I
together?
can get. Yes, we
Oh,
can get
sorry.
you.
Okay. Good evening, everyone, and welcome to all those who are just joining us. Thank you to Dr. Sintieh and Dr. Brohida for their brilliant presentation. I'm Fosso Epiphany, a psychiatric and mental health nurse. So I'll be taking you on the coping strategies. So we are going direct to the point. We all know in all problem solving strategy, the first thing is to identify the problem. And I want to believe that with the previous presentations, we're able to identify one or two problems. So how can we cope with the stress that COVID is bringing about? The first thing is to learn about the symptoms of COVID-19. Learning about the symptoms of COVID-19 will really help us to avoid a type of panic situation or decrease our anxiety level, because we all know the symptoms of COVID-19 can also be related to other conditions that were even existing before COVID-19. So that is very important. And the next thing we need to do is to avoid watching, reading, or listening news that makes us to feel very anxious or distressed. What may cause anxiety or distress to me may not be the same with you. So everybody should know what does not work with him or her, or what does not help her. If you realize that watching a particular channel or watching a particular type of information is causing distress to you, the most effective, cheapest, and most affordable thing for you to do is to avoid watching it. And you need to seek information from validated sources. We know the effect of fake news. And how do you avoid fake news? You need to consider the source of the information. And if you are looking for an information, it's better you go directly to the source. And even when you are in the source, you need to know what you are reading. So that is going to help you. And we also encourage to share only accurate and validated information about COVID-19. With the previous slides, we discussed we discussed about the effects of fake news in we the about of fake news, and we also said some informations can actually can actually cause distress in us. So in as much as we are protecting our mental health, we should do our best to protect the one or of others. So if an information is causing you distress, it's better you don't share. Or if you are not sure about the veracity of the information, it's preferable you don't share, because you are also protecting others. And you need to adapt new routine. COVID-19 has come to change and has changed many things. We need to continue living, but how are we going to continue living? Once you are doing anything, you need to make sure that you are not exposing yourself to the infection, you're not exposing people around you. So you need to adapt your routine, you need to change some of the things, change the way you were doing some of the things. You need to do new things, and you may even need to abandon some of the things you were doing. But life must go on. You must do something, but just the way you have to be doing it, that is changing. And you need to, at times, you may feel so tired, even so worried. There are some things that may help you. You may need to take a deep breath. You may need to stretch or meditate. We are not going to expatiate more on this, but I will encourage everybody to download deep breathing exercises or even deep muscle relaxation exercises on YouTube, and you can follow the instructions, and then just imagine you were with a therapist, follow it, and you will see it can really, really help. And it's also important to eat balanced diets, to eat balanced meals. We say try because we know food can actually be a luxury for some families or for some regions here in Africa, even in Cameroon. And then why do you need to eat balanced meal? When you eat balanced meal, it will help to build up your self-esteem. It improves your overall energy, it increases your brain function, and it might even reduce depression symptoms. Balanced meal boosts up your mood. And we know that with the previous presentations, we understood the importance of our immune system in the fight for COVID. So we know when you have more symptoms, you panic more. So if you have a good immune system, your body will be able to you will be able to fight the infection if at all it even occurs that you contact it. So we also encourage you to try as much as possible to eat balanced meal. And it's also encouraged to keep a good mental health. It's also encouraged that you to exercise regularly. You may not go in a normal way of doing exercise, maybe in group, not any exercise that would not any sporting activity that will not respect the barrier methods, because you may get infected in the course of doing exercise. But it is very important for you to continue exercising, because sports will improve your concentration. It reduces stress and depression. There are actually studies that have proven that sport will also improve your sleeping habits. Sport will help you to maintain a healthy weight, and there are also studies that will actually explain the relationship between obesity and low self-esteem and the risks of depression, risks of suicide. Yes. And also when you do sport, it boosts up your confidence. It is very important to do exercises. In fact, for those who were not doing it before, encourage you to engage in some exercise. You must not run a mountain race for you to consider that you did exercise. You can even exercise at home, and you need to get plenty sleep. In the previous slide, we saw that exercise can can can, can help in your sleep, can improve your sleeping habits, and other things you can do to help your sleep. You need to avoid caffeine. You need to avoid sleeping so much in the day of a napping. You need to cultivate this habit of sleeping at a particular time and waking up at a particular time. When you overnap during the day, your body may not necessarily have the need to rest again in the evening. And then you eat healthily, that will still help. You take a warm bath in the evening, you sleep in a comfortable bed, you dress up properly, you avoid very uncomfortable tight dresses. Like, just imagine somebody sleeping with a chain, with a belt that will be breaking him. I don't think the sleep will be complete. Something will obviously interrupt within the night, and you avoid sleeping with bright light. At times they even encourage aromatherapy. For some people say listening to cool music will improve their sleep, though some books will also discourage noises during sleep. They encourage people to switch off every electronics while going to bed. So try that, it's going to help you, but still there are some things you need to avoid in the course of searching for good sleep. And this takes us to the next slides. You avoid alcohol for whatsoever reason. You avoid drugs. Some people take alcohol to improve their sleep, but if that is not good, you need to avoid that. And some people take alcohol and drugs to cope with the boredom and stress, as we saw in the previous presentation. But taking this can lead you into more problems. You can become dependent, and you can even develop other mental health conditions like substance-induced psychosis and other medical conditions. Our doctors are better placed to name them, so I will not lay more emphasis on that, but you need to avoid that. And you need to make time for leisure. When we talk of leisure, we think of play, we think of joy, we think of relaxation, we think of enjoyment, we think of happiness. Everything that comes with leisure is just positive. We need to make time for leisure, because when we are talking of leisure, you can, with COVID-19, you may not be able to do some of the things that used to bring you enjoyment, but you need to adapt new ways. This is a time for you to be creative. Try new things. If you try something, it doesn't work, you abandon, you try another one. And if you try something new, it works, that's going to boost up your self-esteem. And you can see on the image, this father is not out maybe in a nightclub exposing himself with others. He's not out in the beach or the swimming pool exposing himself with others. He's with a child and they are playing at home, and you can see on their faces that they are really enjoying it. Once you are having leisure, at that time you cannot be thinking about the deaths related to COVID. You will not be thinking about the possibility of you being infected at that time. Everything that will be coming to your mind will just be positive. Yeah, it is very important to keep connected with our loved ones. It helps our mental health, and it also helps the mental health of the person you are keeping connected with. It may not be possible for you to take your normal flight to go to the other city to meet a parent, or to take public transport, expose yourself to travel to see a loved one, but there are other ways you can derive. There are other ways to do it. COVID has come and has changed so many things. We had no choice than to adapt the new ways of doing things. As you can see on the screen, the family, I want to believe that the child apparently recognized somebody she knows, And that's the way they do things. You can see smile on their faces. It actually helps them. And this actually it can reduce the risk of the rate of people having depression. It can also even reduce the risk of suicide, because some people that in their corners, they are dying inside of them, but they just need somebody with whom they can talk. And this is the opportunity for you to share your problems and to intervene on time in case of anything. And for children, yes, COVID can also affect their mental health. What can you do for them? What you have to do is to explain issues on COVID in a very basic language they can understand, and you can even model it, show them the example as what this model is doing on the screen. And you need to talk to people you trust about your concerns and how you are feeling. We saw in the previous slides that you need to keep connected with your loved ones. Assuming nobody is even trying to be connected with you, or assuming you yourself, you not even try to get connected to someone, you will not even have the opportunity to share how you are feeling with somebody. So this is actually also very important. And you need to protect yourself. You need to be supportive to others. The aim of this workshop is to arm us, equip us to be able to take care of ourselves, to also be able to take care of our mental health. At times we are even having mental health issues and we are not even realizing that that is a problem, and we don't even know how to go about it. So now I will ask us a question. What have you been doing before to take care of your mental health? What have you been doing before to protect yourself, to protect your mental health? What new have you learned? Because we are almost at the end of the presentation, and now have you been supportive to others? This is a serious question. Have you been supportive to others? Are you supportive to others by stigmatizing those coming out from quarantine? Are you supportive to others by stigmatizing those the confirmed cases of COVID or the suspected cases of COVID? We know people should not misunderstand me. I'm not asking you to go and hurt someone, impress the person to show the person that you are supportive. No, that's not what we are talking in this context. There are many things you can do to, in fact, to be supportive to someone. Even a call, just to call the person and let the person know that the person is not alone. Hello, are you there? Know that you are not alone. You are not passing through this alone. And do not hesitate to call if there is anything we can do to help you. Only this sentence can really help, and you say it sincerely and really, but do not hesitate to call if you think there's anything we can do to help you. And then they call and say, this might even call me for waiting. This is Pidgin in Cameroon. So please be supportive to others. This is very, very, very important. And I want to believe that those who are not supportive is because they don't even know the facts about COVID. They have not really understood what COVID is all about. So we are not trying to blame you, but we want to believe that from this presentation, we're able to clarify certain things. And even after everything, you may still feel so overwhelmed or concerned that COVID is affecting your ability to care about yourself or your family, or actually COVID is already even affecting your ability to care about yourself and family. At this level, you need the care of a specialist. It is very unfortunate that all over the world, not only here in Cameroon, very little or nothing is being done about the mental health effects of COVID. So I don't know what is obtainable in your country, but if there is a toll-free number for psychological support, psychological first aid, do not hesitate to call that number. If not, please direct yourself maybe to a health facility and you present your problem, and then they're going to direct you to a specialist that will better take care of you. So in my presentation, what I did not say is that I'm the founder and president, currently president of this group, Healthy Brain Cameroon, and we are equally helping at our level by providing remote psychological support and psychological first aid for anybody who needs it, and it is free. Thank you.
Very much, Ms. Epiphany, for that brilliant presentation. To all those present, we've come to the presentation part, to the end of the presentation part of this workshop, and we are having presently 15 of us on the workshop, and we now open to questions, interactions, and contributions. We are aware that we have health professionals and experts too on the panel. If there are some lights you want to throw to the world about COVID-19, your experience with COVID-19, some things you want to educate the world, because we're actually streaming this live on Facebook. So if you have some insights, like we said, you look at the control tab of the Zoom app we are using, and there is an option for reactions. There you can see raise hand. So you can raise your hand, and then we'll pass on you will take over the mic and then share your question, your contribution to the workshop. So thank you all for making it right up to this point. And so we are open to your questions, interactions, and suggestions. Can everyone get me?
I'm still there before I mute my mic, but I'll open it with you.
While we are waiting on the other participants, their questions and contributions, I would like to ask the mental health expert, given that under the effects of COVID-19 on our mental health, we mentioned that social media addiction was one of the effects. Could you please tell us how to cope with this using your specialist advice?
Hello, are you getting me, please? Are you
Yes, we're
getting
getting
me?
you.
We can hear
Yes, we're
you.
getting you.
For the question. Now, I want to consider it like a diagnosis. If they diagnose somebody of social media addiction, we all know that we give individualized care. So the therapist or whosoever is caring to taking care of the person may need to give the person exercises, individualized exercises, particular exercises, assignments, depending on many factors. What is taking the person, what is drawing the person more on social media, and so looking maybe for ways to replace those particular activities in another way. So we cannot give a clear solution for everybody. But if I want to speak generally, what I would say is that if you are realizing that maybe you're already becoming addicted to social media, the first thing is to have a diary. In the morning, you write down all the activities, what you think what will occupy your day, and you try maybe to give time for every activity. So each time you even want to go back to your phone, it's not like you will not give time to your phone, because you cannot just go like it will be like a winning process. Like if before I was spending, let's say, 10 hours a day on social media, let me say, okay, the first day, day one or week one, let's drop maybe to 8. And for us to drop to 8, you need to find something to occupy yourself within those 2 hours. It has to be gradual, and then you really need to cultivate a type of self-discipline and determination to come out of it. So you write down the assignment, what you think, the activities of the day. You try as much as possible to follow them, and then in the evening you try to evaluate it. And for this, you actually need a coach. So that is what I'll first of all encourage the person to do. Hello? Hello?
Yes, we are following. We are following.
Yes, I don't know if what I'm saying can be helpful.
Thank you very much, Miss Epiphany. I think that I am learning, and even the participants are also learning, because social media is really a concern in this 21st century. Thank you very much.
So thank you, Dr. Brunhilda, for that question. I have a question here that reads, let me share with you people. The question reads, we want to know why, how come that everybody, how to overcome the fear of reading any post talking about COVID-19. So the person wants to know that how do you overcome the fear of reading every post talking about COVID-19? Um, Mr. Epiphany, I think you're best placed to answer this question.
In the presentation, I think we mentioned something about it. The first thing is the person should be able to identify the trigger of his or her fears. So we identify the trigger, and as I said earlier, the most affordable thing for you to do, cheapest, easiest to do, is to avoid the trigger. Then now you can fall on something you did not expect to see. Okay, you are already exposed to the trigger, the fear is already there. What can you do? You can just decide to leave the environment, be in another place, and try to focus your mind on something positive. And if at that moment it is not working, try deep breathing exercise for some time. Yes, try deep breathing exercise, and then you try to occupy your mind. Try to occupy your mind with something positive. So that's what you can do to help yourself. The first thing, avoid the triggers. Avoid it. Not every
Thank you.
news about COVID will cause distress. Yes. And even in your phone, if it is coming through social media, I'm sure you must have identified the people who always send you news that will cause you to have symptoms of diarrhea. It's first better you tell the people how the effect of that information in you, because they may not even know that they are causing you distress. Tell them in a polite way, my brother, my sister, you see this type of information like that. In fact, it's difficult for me to take it. Please, if it's not something sweet, do not share with me. Yes, the person will understand. Some people do it, they don't do it consciously. It's not even only for COVID, for any type of information.
Okay, thank you very much, Ms. Epiphany, for that clarification. We have another question here in the chat, which says, hello, I want to ask about the placebo effect in relation to COVID-19. Does the patient's belief have an effect in their experience of the disease? All right, I think I'm going to throw some light on that, and then any of the panelists will want to add something. So yes, the placebo effect is always present in any disease or in any circumstance. So you believe that something is happening to you, it might manifest itself. Dr. Brunhilde did a slide which came about because psychosomatic disorders. What you believe might manifest on you. So your beliefs might actually might actually even manifest in itself in symptoms. So if somebody beside you think that had COVID-19, just by you thinking that you might have it, you might manifest with the symptoms. It's very, very possible. And so our perception will affect us positively or negatively. The negative parts are the psychosomatic disorders. The positive effects are the fact that if you believe that the disease does exist, you want to take all the precautionary motives not to get infected. I don't know if this is clear enough, but Dr. Bonida, you can throw more light on that.
Like Dr. Cynthia rightly explained, whatever the mind thinks, the body manifests. So just like the example he gave, you come across a person who has coronavirus with cough and catarrh, and all of a sudden you start feeling like, maybe I already have, your throat starts itching, you start feeling like you don't have enough air, you're breathless, or you develop cough and all, just because the mind and the body work together. So it's just your mind giving commands to your body to manifest those symptoms, not necessarily that you have coronavirus. But that does not mean that if you have those symptoms, you should take them lightly, unless you you need to seek medical attention, because they may actually be symptoms of coronavirus. We don't deny that. So I don't know if that answers your question.
Okay. I don't know if it's Miss or Mrs. Elizabeth. This question is coming from you. If you think if there's any addition, you can just verbally voice it to us so that we actually attend to your worry.
Just share this. I think it has something in relation with our worries. When this issue of COVID-19 just started, in my health facility, through where we had some suspected cases. When the staffs heard that there are suspected cases, everybody was like, I'm having sore throat. I'm having sore throat. It's like I will have catarrh. It's like my body will pain me. I'm having sore throat. But once they announced that none of our suspected cases was positive, all the symptoms resolved automatically. So our psychology actually has in fact a lot to do. But this is just also one of the mental health effects of COVID. If somebody is already developing the symptoms of having a psychosomatic disorder, he or she needs care, and that is the importance of presentations like this. We are not minimizing your complaint, we are not minimizing your problem. Your problem is actually a problem. That's why we are here today.
Thank you very much, Ms. Epiphany, for that addition. We have Mr. Rene Eta with the hand raised up. You can unmute your mic and ask your question. We are here for you.
All right, can everybody hear me?
5 on 5.
Yes.
Awesome. So, yeah, I am Rene Ita, and I understand majority of the audience here are all from medical background, and a few of us are not from a medical background. So, my question will go to you all who are from a medical background. Lately, it has become a common phenomenon for people to disbelieve the cause of death in Cameroon and even the world at large. Yeah, nowadays some people do believe that doctors attribute all deaths to COVID-19, and some doctors even stop treatment to patients on the grounds that the patient is will eventually die, or for the fear that they don't want to contract the disease. So my question is this: this alone is giving some patients or some of us who maybe have not been sick before some worries. Or you as a medical doctors, how can you all assure us that not all patients who come to the hospitals, or not all the deaths that you all attribute as COVID-19 cause are all COVID-19 related diseases?
All right, Mr. Ita, are you done? Are you done with your question?
Yes.
Thank you very much for that question, and I think I'm going to throw it to the entire audience. And I'll first of all say from my own part, yeah, here in Yaoundé where I work, yeah, we have some natural deaths from other causes. Malaria still kills, typhoid still kills, TB still kills, and accidents do occur, patients still die, and yeah, they have their death certificates that have those things, the diagnosis attached to it. So every corpse that you find in the mortuary will actually will go with a death certificate, and you have there the cause of death. So in our setting where I work, we haven't had a COVID-19 associated death, because once we have somebody who is tested positive, this person is taken to a treatment center. And so the death cases that are announced with respect to COVID-19, from what I know, here in Cameroon in particular, are cases that have been taken to the isolation center, and not persons that are in the community or are in general hospitals. So that's the first thing that we have to know. All the cases of mortality that we've reported are actually cases that have been taken to the treatment center. Now, for the fact that we'll stop treatment from you because we are afraid that we will get infected, or you have COVID-19, well, I can't say 100% that it doesn't happen, but yeah, everybody is scared, especially at the beginning of the pandemic. Persons were actually very scared about it, especially if you don't have the protective equipment. But most health facilities now will receive you. There's nothing you will see that will drive you out of the hospital because you are coming to consult at a particular time. If the doctor is there, if the nurse is there in the hospital, it's actually to attend to those who are sick. And this pandemic has made work really laborious for most health personnel. Those of us who are in the panel can attest. So we are attending to an increasing number of sick persons daily, either because they are having poor hygienic habits, they're having poor feeding habits because of the quarantine, the hardships associated with the imposed lockdowns and restrictions of the COVID-19. So yeah, one reassurance for you, Mr. Ita, it's not to be afraid to come consult in the hospital. Yeah, if you see a doctor that wants to reject you, I don't think there's any of us here or there's a doctor out there who will be sitting and waiting to reject the patient. So at this juncture, I will leave the panel open. I see Miss Dr. Lanike's hand is up. I don't know if it's a question or it's a reaction to these comments, but if it's a question, we'll take it, or if it's an addition, you are welcome to take over to unmute your mic, Dr. Lanike. Thank you. Hello? While we wait for Dr. Lanike to come on board,
Hello.
Dr. Brunhilda, Miss Epiphany. Okay, yes, Dr. Lanike,
Sorry, I
you
have
have the
a
floor.
separate question, but it's not really. I have a different question. I don't have anything to say on this topic.
All right. So okay, so let's clear off Mr. Ita's doubts. If you have some additions, you can just add. Dr. Brunhilda, everyone on the panel, you have the floor. If you want to say something with respect to clearing Mr. Ita's, reassuring Mr. Ita that the hospital is safe for him to come and consult, please, you're open to do that.
Hello, can I add something on what you just said in relation to Mr. Ita's worry?
Yes, Miss Epiphany, your volume is a little bit low.
Hello?
Hello, Miss Epiphany, we are getting you.
Can I go on?
Yeah, you can.
Yes. Um, before we all know that before they conduct the test on someone, the person must have presented with some signs and symptoms, and the person was declared a suspected case of COVID. And it's only the test that will confirm if actually the person is a confirmed case of COVID or not. But now, along the line, some people die within the process. They die when there are still only suspected cases of COVID. And we know the risks of handling coughs. We know what should be done when somebody is positive. So now, what should we do? Should we just neglect the coughs and maybe expose the person, other people, when we are not really sure if it was a positive or a just a suspected case or a negative case? We actually lose nothing. This is my personal opinion. We actually lose nothing taking the precautions as if it was a positive case of COVID. So that's just my opinion. Unfortunately, some people will die without us knowing if it was a confirmed case or the person was negative. But we need to go on. So what should we do? So my opinion is that we lose nothing, just treating the corpse as if it was the corpse of a positive case to avoid exposing other people. And I think this is what is being recommended, which for me has actually no problem. I know it is very painful not to be able to mourn your loved one in the way which is in fact in a culturally accepted way, the way you used to do. I know it is very painful, but for the sake of other people's life, it will be good we actually accept that as have been seen in COVID has come and has changed many things. So thank you.
All right. Thank you, Miss Epiphany, for that addition. Dr. Brunhilda, any additions to that point before we take Dr. Lanike's question?
I'm sorry, I was away, so I don't think I have a contribution to make.
All right. Ms. Laita, are you okay?
100%.
All right. Thank you. Well, rest assured that we are doctors because we want to take care of the sick, or there are sick persons out there. And yes, the pandemic is scary because we are humans. So there is that fright from everybody. But presently, we'll give you the utmost care if you come to the hospital. There's no physician that is going to reject you for coming to consult, because everybody is not going to work except the doctor. So why would the doctor or the nurse go to work and not receive a sick person? So be rest assured, your family and yourself, you people are safe in coming to the hospital in Cameroon. And not all deaths and not all deaths reported are actually COVID-19 related. Thank you very much for sharing with us what actually bothers majority of the population also. Dr. Lanike, you have the floor.
Good evening. Thank you very much for the presentations. They were very enlightening. I have a question which I think that the whole panel, I need that the whole panel should help explain to us, the health practitioners especially. Okay, when a patient comes to the hospital and he tests positive for COVID-19, it's not the same as somebody who has, say, malaria, and you just tell him, okay, this is the situation, you have malaria, we are going to place you on treatment. I would like to know, are there some steps that we can gradually counsel the person, because the manner of approach in telling a person that he has COVID-19 matters in how that person is going to react, and maybe his consequent behaviors from there. Because I think a lot of problems in our setting is linked to the fact that patients and their carers are not properly counseled. So is there any, I don't know whether it's like a procedure, but is there any way that we can go about it to make patients and their carers accept their diagnosis calmly and proceed to the next steps of treatment? Thank you very much.
Thank you very much, Dr. Lanike, for that question. Uh, we are very thankful for that question. It's actually a concern, and we hope that you will be able to share with you from our little experiences. Dr. Bonheda, I think she will take this first. We are experienced in Douala, which is actually a hot zone, and I'll also share with my experience in Yaoundé, which is also a hot zone.
I started, Dr. Proheda is not there.
Uh, she, Dr. Bonheda, are you there?
Yes, I'm here. All right. With respect to giving patients the information or telling them that their COVID-19 test is positive, in my opinion, first of all, I would say that the way the information has been or the way the disease has been put up, it sounds like a death sentence. In a way that the moment you're telling somebody that you have COVID-19, it's as if the person is going to die. That's the first I think that's the first that's the first way that our problems are starting, because if these patients knew that okay, even if 100 people are infected with coronavirus, not all of these people will actually even present with symptoms, not all of these people will actually be admitted, and not all of these people are going to die. I think they are going to take the disease in a different way. For example, the same way people die from coronavirus, it's the same way people die from malaria every day. It's the same way people die from heart failure or diabetes. But then it's the way we have portrayed this pandemic to people. The moment you're telling somebody that okay, you are COVID-19 positive, it sounds like okay, you're telling them that just go and pack your things because you are going back to the mortuary immediately or to your grave. So where I work, we don't do testing for COVID-19 patients, first of all. So any case that we suspect, we refer to the public hospitals for confirmation. So I don't know how whether they have a unit where they work, where I mean the unit where they tested at the testing centers. I don't know if there's a unit there that to properly counsel the patients. But I feel like if people actually knew that coronavirus is not a death sentence, we would not have too many problems like we have now with patients. I don't know if my own contribution even makes sense, but I think that's all I can say for now.
All right, thank you very much. Mr. Epiphany, you have something to add?
Please, are you getting me?
Yes, we can get
Yes,
you.
now.
So I understand how I can imagine that it can be distressful for somebody to hear that you are a suspected case of COVID. And my own opinion is that everybody should have a training on psychological first aid, because for me, for you to get that news is for me is equal to a crisis situation. If everybody has a training on psychological first aid, at least you know everybody must not even have a skill on counseling, but everybody should have basic knowledge on psychological first aid. You know how to which approach to use in which situation as far as this COVID is concerned. But now in our own health facility, what I do is that once you are declared a suspected case, because we don't do the testing in our health facility, we are not a treatment center. When you are a suspected case of COVID, I have all your information. and I provide you psychological support till the time that till the day that you no longer need it. For some people, I may call once, twice, thrice, and they don't need to call any longer. For some people, I may need to call them for a longer period because maybe after the results came out and then it was positive, I need to call. I need to go with them through this situation. So that is what I do in my own health facility to help people. Having the news that you are a suspected case of COVID-19 very distressful, and then the manner they tell you that can also be very distressful. And when some the people, the patients, when they come to the hospital with their own conception, with ideas, say when you come to the hospital, they tell you that it is COVID, you go and die, or they are just driving you away, because some people are already so attached to some health facilities that when you when they come and then you ask them to go to a different place, it's as if everything was finished for them. So maybe at that particular time, their brain, their mind is not ready to accept anything you are saying. So that's why I'll always give them time. So the calls I make most of the time is very early in the morning or late in the evening. You allow them to be calm. You know that at the time you are calling, they'll be able to listen to you. And the calls are actually very helping. They're actually helping. They help so much. And I also think that if the government could also make available toll-free numbers where they can call they themselves, because now we are the one going to them to give the care because we believe that they need it. But some people can also be out there, they need the care, but they don't know who to call. And some people may even know who to call and they don't even have the means, the airtime to call. So that's my own contribution.
All right. Thank you very much, Miss Epiphany, for that addition. What I would say from my own end here in Yaoundé is that well, patients who come in with symptoms, we have a triage, symptoms that actually are suggestive of COVID-19. We have a triage and we take them into a separate unit where actually um, we actually I cancel the patient first that yes, we think that you have COVID-19. And well, having COVID-19 is not a death sentence, but because we are in a pandemic and we have to be sure that it is not COVID-19 before we treat you for other symptoms. It might just be a common cold or another pneumonia. So that's what we do for most of our patients. And once we take them to this area, we call actually the WHO base here in Yaoundé, where they will come and collect the sample. Now, once the WHO team comes here, they actually reevaluate the patient. Now, if the patient is the patient that needs to be hospitalized, they will take the patient to the isolation center. If the patient is a stable patient, the patient is told to go home and self-isolate, and also further told that this is not the end. So now, the tax we have, because early on it was challenging, as Dr. Lanike said, it was challenging to get them convinced. But the tax we all use here is to first of all tell them that we know that you might have COVID-19, but it's not a death sentence because people get healed from it. It's just like another cold. But we cannot proceed with treating you for another thing when we are not definitely sure that it's not the pandemic. So that's what we do, and it really has avoided a lot of exchange between the physicians and the participants. And I think here in Yaoundé, some persons actually come to the hospital and ask you to test them. There are actually persons that come like that and tell them that no, I think that I've been exposed, I want to be tested, or somebody is coughing around my neighborhood, I want to. So it's actually something that comes with time. It comes with time, with a lot of sensitization on the population. And so that's it. That's what I could add from what we do here in our center here in Yaoundé. So Dr. Lanike, I don't know if you are clear, but if anybody has an addition on the forum, you can just raise your hand and you'll be to this particular point, you'll be giving up the mic to talk and help us know how we can best take care of our Cameroonian population or our African population.
Okay, let me just say something before the next person comes up. All right. I currently work at the regional hospital in Bamenda. It's the Northwest Treatment Center for the COVID-19 cases. And believe me, what we see here, I don't know if I can say it's tragic, because there are people who stay home and then they come. Okay, like for example, for some calls I take, you see somebody coming in with all the classic symptoms and oxygen saturation is 23%. And then when that person dies, the family, like, even if you're trying to counsel them before, they will tell you that no, their person has never been sick before, and that this small hospitalization cannot be due to those symptoms that you're talking about. So I don't know, we've had this problem a whole lot. So I don't know, I'm just proposing to the panelists that if they could make a small training, maybe for the health practitioners on this basic psychological first aid, it will really go a long way to help us who are working on the first line. Also, the mental health specialists may be many in Yaoundé, but I think in our hospital we have just one or two nurses to the whole population of Bamenda. So you can imagine how tedious it can be. So at our own individual levels, we have to help to reduce the amount of work that each person is supposed to face. By doing our own small little part. So if that training can be done, it will really go a long way to help us. Thank you.
Thank you very much, Dr. Lanike, for that addition. And yeah, that's inspiring. And I think all of us here present, we are definitely going to be in the next panel to prepare the population for that. I have an addition from Dr. Fosso to Mr. Rene's points. Okay, it reads that you have to avoid any form of information that will cause you distress, like we've said throughout this presentation. Social media propagates a lot of false and unverified information, especially about health workers refusing to take care of patients or lying about the cause of death. So while some of information may be true, most of it is false. So for the sake of your mental health, know that the hospitals are always open and ready to receive you. If need be, you may be referred to other appropriate facilities for better management. So stay positive. This was Dr. Formoso's reaction to Mr. Rene's question. It's actually in the chat, so I just had to read it out so that we know. So there's a lot of information out there. Filter through the information, get it from verified sources. Read from the WHO website, read from the Center of Disease Control, USA, read from the African Center of Disease Control website, read from the Cameroon Ministry of Public Health, read from the Ministry of Public Health of your own country as well. So we have Mr. Ismaila Essa. His hand has been up for some time now. So you have the floor, sir.
Thank you very much. Good evening to all. I'm Ismaila Issa from Bafusam. Sorry, I did not follow all the presentation. I'm just following the discussion forum right now. I don't know what I will say, if it has already been said or not, because I just followed recently. Are you getting me?
We are getting you 5 on 5, sir.
Okay, thank you very much. So the first thing I want to comment on the question that was said was there should be a counseling that should be done at the point of suspect, which somebody has already given it, which a background information, and like what HIV methodology is done on counseling, that a background information is discussed with the person with all the options about if it is positive, this is what should be done, if it is negative, this is what should be done. And this is what is to be done with the support system if you are quarantined at home or not. The second counseling should be done on the day of sample collection again, to reinforce again, to clarify on the information that the person missed the first day or when the person was suspected, because there will be that denial syndrome on the first day. People are wondering, am I the one who is having COVID or not? Then the third counseling that should be done again is at the level of the return of results, if the result is positive or negative, So if the first counseling on the day of suspect was well done, and the day of sample collection, then it's easier again to return the result, either positive or negative. Then my fourth point is that support system. So again, a lot of information need to be explained about quarantine, transport system if the person is positive, and the treatment protocol and option and the outcome, you know. And again, just to remember the team, to remind the team, I don't know if it has already been discussed again, the treatment protocol and the epidemiology, which shows that AT I should share.
Hello, seems we lost Mr. Issa. No.
Yes, thank you very much. I'm done. My phone went off, so I came back to connect again.
All right, we didn't get clearly the last point. If you can just add on, we'll really love that, Mr. Issa.
Okay, thank you very much. I was just saying that maybe this forum or this team develop an SOP on counseling in the advent of COVID-19. Like all these points of methodology, what should be said on counseling on the day that the person is suspected, what should be said to the person, what should be there, or what should be said on the day of counseling, just some points, what should be said on the moment of returning the result to the person, and the support system that exists either when the person is quarantined, is it at home or in the isolation centers. If the person is positive or the person is sick, what can be said about the transport system, and again the protocol of treatment. You know, some people, once they are suspected, they go already and they are taking the medication. So because of, you know, they're mentally not stable because of that. So again, the protocol and maybe the side effects of some of the drugs, and you know, it is important to have a prescribed drug than to go and buy my chloroquine or azithromycin in the facility. So just the last point to summarize is an SOP on counseling.
Okay, thank you very much, sir. Those points were all noted by the team. Okay, so we have one question in the chat which says, is it possible to do an autopsy on the COVID-19 suspected corpse to actually verify if it was from that, from it? As of now, we don't know if autopsies in Cameroon in particular have been approved for COVID-19 corpse. In order, it's a pandemic, it's a new disease, you want to reduce manipulation in as much as possible. That's why we try to test persons early on before they dead. But if someone dies in a hospital where there's no facility to test and the person had several symptoms suggestive of that, we just need to ensure that they practice the safe disposition of the corpse, either even if the family has to be there. Last week, I think the Ministry of Public Health actually released a guideline on how corpses should be handled if the family must have them buried with them. So we are going to share that later with everybody. So I don't know if any of us still have any reactions, any questions. This workshop was supposed to end at 7:30 p.m., but we're already 30 minutes past, and we hope we are sharing a little bit of what we actually wanted to share, and most of us have learned. So for us present here, any questions, any reactions to the panel, anything you want to teach the world. Like we said, this presentation is going on live on Facebook, and so many other persons are watching who are not in the Zoom workshop. So let's share what we have. We have a handful of health professionals here present, mental health professionals, and other social experts. So the forum is open for interactions, while we hope that we round up in the next 10 to 15 minutes. All right. We're still waiting for questions or reactions. Without which, I'll just read the names on the dashboard and you might say a word for the panelists or a proposition that can make uh, any other subsequent outreach through this media possible. So the very first on my screen is Miss Taniso. Do you have any words for the panelists? Do you have anything to contribute on the forum? All right, Mr. Rene, any contributions, any additions for the panel?
Hello.
Hello, Mr. Rene, we can get you.
Oh yes, yes, I'm back. So, I just have a little concern as concerns the current pandemic situation. It looks like we are currently having a second outbreak, which, to my understanding, we are not seeing cases rising in Africa as compared to here in the Western world, like the US and probably Asia. So I just want to find out why the reason, if you guys can share some of the reasons why we are experiencing this second outbreak, these numbers are coming up again. Has there been any research done as to why, when we thought that the situation is coming under control, we are now experiencing some new cases?
All right, thank you very much for that question. I don't know if any person could take that up in the panel. So while we wait for persons to add up, my reaction to that is, in an epidemic or a pandemic as this, there is always a chance for resurgence of new cases, because when a disease comes out first and the exact source is not known, like is this COVID-19. So persons get infected, this number of persons are maybe they get to a plateau phase that are controlled, but we also get to a phase where um, other new persons are exposed to the same presentations, or a different source is actually gotten to. So yes, a new wave of infections have actually been reported in China. And so the exact cause or its resurgence is not, we haven't yet really had the details of the studies that are ongoing, because when it happens like that, ongoing studies starts all over. And so definitely when there's enough scientific evidence on what actually causes this new wave of infections, I think, Mr. Rene, you will have the information spread to unverified media, especially the World Health Organization. So as of now, we say that the only way to fight COVID-19 is to prevent it, because we don't have a candid cure yet. So preventing it is by practicing the social distance measures, the preventive measures, and staying home and making sure that you're healthy. So that's it. That's it. But as we said at the beginning of the presentation, we would always have pandemics so long as the world keeps on doing explorations and manipulating on the animal population, which have their own bacteria and viruses present there and in their natural habitat. We have Dr. Boge raising the hand. Dr. Boge, you're welcome. You have the floor to react to this point.
Can you get me? Can you hear me?
Yes, we can get you. You can try to be a little bit more audible.
Okay, I just wish to add to the point in a bit to explain why most of the times in such a case we have a second wave of COVID-19 cases. Now, in a bit to give an explanation, I don't know, probably it has not been proven, but I think that during the first wave of an infection, we place restrictions, especially the measures that were taken against COVID-19, like self-isolation at homes, no going out, everybody inside their homes. I think within that period, we have a drop in the number of cases because during that period of self-isolation at home, if we have a case that was exposed before the self-isolation and that person is infected, what happens now is that we tend to have the spread of the infection or contamination of other individuals, which is not community-based. It is mostly household transmission. We tend to have household transmission, and within that period, we don't detect those household transmission, but we'll have a drastic drop in the spread of the disease. Now, by the time those bans are being uplifted, those transmissions, which were just household based, start getting into the community and interactions begin again within the community. And within the community, there is a rapid multiplication of the transmission, which was household based before. It becomes community based. And being community based will have a drastic increase in the number of cases, which could explain why we have a second wave of COVID-19 cases, probably in China and even within our settings too. I think that's all I had to add.
Thank you very much, Dr. Bray, for that addition. I don't know if any other person has something to add to the reason why we have a resurgence of new cases. All right. Thank you, Ms. Aita. I don't know if you are enlightened with that question. You're satisfied with the reactions from the panel?
Absolutely.
All right. So next on my screen is Miss Elizabeth Wonje. Any questions, any reactions, any additions to the panel?
Hello. Can you hear me?
Hello, we can get you 5 on 5.
All right. I think it's a question really. My question is, all right, we talk about.
We can get you 5 on 5.
All right. We talk about the mental effects of COVID now. How about when the pandemic is over? How do we manage getting back to normal after practicing the social distancing, face mask, washing of hands, and stuff like that, getting back to the normal routine, how things were, especially in the hospital setting? It will not be the same. And so how do we get on with that? That's my question.
All right, thank you very much for that question. Ms. Epiphany, I think you want to take that. Epiphany is not there. All right, Epiphany is not there. So what I would say is that that's why we're actually holding such a workshop, because from its inception, we've just been talking about practicing social distancing and preventive measures, and no one has really taken time to think about the mental health effect these abrupt changes are going to have on the human population. So this is actually it. Throughout the presentation, we've highlighted post-traumatic stress disorder in particular, which is actually what is going to happen with this. And these coping strategies that were proposed during this presentation are actually to help us say that once this pandemic will come and go, if we are actually practicing these coping strategies during this pandemic, we won't have a lot of PTSD to hold on to at the end of it. Definitely there will be some residual of it, but yeah, it's actually now the time for us to plan for for the future psychological effects the pandemic will have once it comes and goes. I think that's what I can add with respect to your question, Ms. Elizabeth. So I don't know if any other person in the panel has something to add. You can just raise your hand and then you could take over the mic.
Okay, I also like to add that um because of this pandemic, there are a lot of things that we used to take for granted before that we are now like looking at it, taking into consideration those things. For example, before we in consultation offices we have running water, we have soap, we have alcohol. Before you could neglect even washing your hand or neglect using hand sanitizers, but now you by the time you think of corona, as you finish attending to a patient, you just go at once to the sink. So these are things that even I feel that even after the pandemic, it will not go away that easily because it has already stuck in our minds. And also people are adapting to new ways. People are starting to work from home. People have now gone, they're studying online. So all of those things, I don't feel like when the pandemic will be over, things are going to come back to the way they have been. So the only thing is we have to adjust to these changes because I feel like these changes have come to stay. We are not going to go back to the old us. It's true that some other people may have to now start going to work and will not be able to work from home, but then some of these changes are going to stay. And I feel that we already know these effects and we know the consequences. It's for us to adjust to those coping strategies to keep our mental health sane. I don't know. I don't know if that makes sense, Miss Elizabeth. That's the contribution I have.
All right. Thank you. Miss Elizabeth, are you satisfied? Do you have any other worries?
I'm very satisfied and thank you and for the initiative of putting this on Facebook. I found out about this on Facebook and I think a whole lot of people would like to attend workshops like this if they know about it. Thanks again.
You're most welcome, Zay. You're most welcome. So, Dr. Lanike, you're next on the screen. Any additions, any contributions for the panel, for the world to hear? Any words you have for someone out there who might be broken down from COVID?
I just want to thank the panel again for the initiative. It's this whole COVID-19. In fact, everybody says 2020 has a virus and it should be uninstalled and installed again. So I would really like to appreciate the panel for this initiative. And for anybody out there who may be suffering from COVID-19 or has a relative who is infected, I'll just say that don't lose hope. We are in this together. You may not see it, but we are in this together and we will push to the finish. Thank you.
Thank you very much, Dr. Lanike. Now, next we have Mr. Kenchi Joseph. Any words for the panelists, for the world, and for us to stay strong during this pandemic? All right. Next we have Miss or Mrs. Olive Mbok. Any words from you? All right. Dr. Nadia Fomuso, any words from you to the world about our pandemic? All right, we move to Dr. Bruna. Any words from you for the panel, for the world to learn about COVID-19? All right, next we have Mr. Shifu Ismaila. Mr. Shifu Ismaila. Any words from you? Okay, Dr. Borges Ridley, can you have some words for the world during this pandemic? Any words from you as we round up the presentation, the workshop?
Well, what I have to say, um, 2020 is a year with very, very unforeseen circumstances and happenings. It's a year I think it calls for many to take a pause about life as a whole, rethink so many aspects of life, probably um, restructure and re-strategize on their goals and plans. And it's a year for all of us to stay alive. So there is no need to rush. There is no need to feel bad about certain delays we all are having. But it's a year we should all strive to stay alive, no matter what it takes. It's a hard time, but hard times don't last forever. The day will come, it will also pass as others have also passed. I think that's all I have to say.
Okay, Mr. Issa Ismaila, any words from you to the world in particular?
Yes, thank you very much to all. And my last word, as I have said, and I saw Dr. Fosso writing, that I'm waiting. I really appreciate the panelists for this discussion for today, though even I connected late. I'll be very available for the next session. And as I've said earlier, for the SOP to be developed by this panel so that we really rapidly scale it up in the whole country subsequently. Thank you, SOP, for counseling. Thank you very much.
Thank you very much, Mr. Issa. Thank you very much. Miss Epiphany, any last words to the world for about our survival during this COVID-19, especially being mentally healthy?
Okay, thank you, Dr. Sintieh. What I will say is, if you are experiencing any sort of fear, it's not a sign of weakness. It becomes a problem when it affects your functioning. And at this time, we need to be supportive to each other. Please avoid stigmatizing those who are out of quarantine. Avoid stigmatizing the suspected or the confirmed cases. We really need each other. Thank you.
You're very much welcome, Miss Epiphany. Dr. Brunhilda Take, any last words to the world, to our participants present?
I just want to say a very big thank you for all those who have come this far with the presentation. Coronavirus is real, and not only is it giving us cough and catarrh and difficulty breathing, it is also affecting us mentally. And these effects or these consequences are not going to disappear tomorrow or are not going to disappear after tomorrow or in 2 months' time. It will stay longer than we can even imagine. So we know those effects, we know the consequences, we have heard about the coping strategies. So let's make use of what we have learned today in order to stay mentally safe. Share the information with your family, with your friends, with your neighbors, so that at the end of the day, even when the COVID-19 crisis is declared completely eradicated, the psychological crisis caused by it will be completely eradicated. Thank you all so much.
You're most welcome, Dr. Brunhilda, for these last words. So, ladies and gentlemen, this has been the second day of this workshop on mental health and COVID-19, a psychological crisis. We have gotten your recommendations, and definitely we look forward to reaching out to the world yet again with a larger panel on the psychological impact of COVID-19. We wish you well as you stay safe and practice the preventive measures. We know that the pandemic is here, but it won't be here forever. Scientists are working, and we hope we'll have a solution in the nearest future. But meanwhile, we're waiting for the solution. Do your part, stay safe, stay healthy, practice the preventive measures. We wish you all a good night, a good day, and a good afternoon wherever you are, and that we'll see you soon come the end of the pandemic. God bless you all. Thank you.